Namaste Sarvebhyaha. Welcome to Basics of Ayurveda Part 1 for a healthy lifestyle. Let us begin with the prayer. Gurureva gati gurumeva bhaje gurunaiva sahasmi namo gurave na guru paramam shishurasmi guroho matirasti gurau mama pahi guro bravimi samskritam vacha dhyayami samskritam hृदा kuruve sevancha kayena vande samskritamataram yo naras samskritam vyomni yalayam ramate muda samskritim chaiva samskaram vindate natra samshayah. Ram Ram Ram. Hearty welcome to all the participants. Ayurveda is a system of health practices that lead to a healthy lifestyle. To achieve this, we must know about foods, various practices, diet, and regimens. So in this course, we'll be knowing how to be healthy with our daily routines. So please attend the class regularly and let us all become a part of a healthy society. So it's time to welcome the teacher, Dr. Gitanjali. Yes, Dr. Gitanjali, yes, graduated Bachelor of Ayurveda, Medicine and Surgery from SDM College of Ayurveda and Hospital, Hassan. She is practicing Ayurveda for the last 5 years under renowned Ayurvedic physician, Dr. PLT Girija in Chennai. Being a resident doctor for the initial 2 years, she has treated numerous patients and has exposure to various cases. She continues to practice proper Panchakarma at her hospital. Her practices emphasis on Patyam, that is diet modifications, and using only classically mentioned medicines in her treatment. Hearty welcome to Gitanjali ma'am on behalf of Vyoma. So before starting, I would like to give basic guidelines to join the webinar. So as you all know, it's you have to open the web page, that is www.sanskritfromhome.org with your credentials. Once you log in, you'll be taken to the student's dashboard. There, in join now button, you can see there. Once teacher starts the class, it will be highlighting. You can join through that button. And this webinar, you can join from any PC or any Android devices or any iOS devices with better internet connection. So you'll be having for queries and doubts, you'll be having raise hand option, question and answer, and you can mute and unmute yourself to unmute yourself while asking the questions. And for better audio interactions, you can use your headphone. And for any queries and doubts, you can reach us the teacher, that is gitanjali.vyoma@gmail.com. And any other qualification, you can mail us, that is sanskritfromhome@vyomalabs.in. So it is please close, it's an important note, that is please close all your unused apps or browsers so that you will not be having any kind of network issues. So thank you. Ram Ram Ram. Ma'am, over to you.
So I would like to thank one and all and each and every participant who have joined this course and come today. I would also like to thank the organizers of Vyoma and Sanskrit from Home and all those who have helped in this journey. So the main aim and basic intention of this course is to create some awareness about Ayurveda among the general public and how the simple principles and regimens that are mentioned in Ayurveda can be implemented in your day-to-day living. So the main aim of Ayurveda is swastasya swasthya rakshanam, aturasya vikara prashamanam. So the first line being swastasya swasthya rakshanam is maintaining the health of a healthy person is always considered the primary aim of Ayurveda, and this is done through a lot of text or contents that is given in Ayurveda. So the acharyas have given a lot of importance to maintenance of a healthy person Only after that, in the further chapters, treatment and disease related symptoms and all that is given. So by understanding the first few chapters, a lot of us can make some changes in our life and maintain our healthy life, or prevent from getting unwanted diseases that we come across. So this is a small introduction. I would also like to mention a few prerequisites before we go to this class. So I request you to kindly mute your audio and video throughout the presentation, and refrain from asking any doubts in the middle of the session. You can always note down your doubts and queries, and please ask the doubts at the end of the session, so that none of the doubts go missed or there is no interruption during the um, seminar or PPT. And also, kindly ask doubts that are only relevant to today's session. So I think all of you may be having a lot of doubts regarding various concepts that you might have heard, but I request you to limit your doubts to what is being covered today. And also, no personal questions or personally health related questions or anything regarding different concepts or different Ayurvedic things will be dealt or covered in today's session. So if you have any doubts that are relevant or want to be answered, kindly drop it in our mailbox and you will get a reply accordingly. And also, if there are any doubts that go unanswered or need further reference and getting back to you all, it will definitely be done in the coming classes. Or if some of them go unanswered due to time shortage or anything like that, they will all definitely be covered by the end of the session and made a note of. So to repeat again, this is a very basic course of Ayurveda. It is not an advanced or a very elaborate course on Ayurveda, its treatment, or going into all the details will not be done in this course. It is keeping in mind the larger audience who we thought or who approached us saying they do not know anything about Ayurveda, or even for that matter, some of them do not have any knowledge about Devanagari or Sanskrit. So who have no knowledge about this. So many of you attending this course may be well versed with Ayurvedic texts or Shastras, or going through the Vyakyanam or all the commentaries. So this is not in that level of understanding of the text. This is in very layman language, how our basic day-to-day living Ayurveda can be implemented. And most of the references taken through the PPT are from Ashtanga Hridayam Sutra Sthanam. We will not be covering all the details and the other references of other granthas. So moving into the topic today. So today's class will be an introduction to Ayurveda, which will cover some of the very basic principles or some of the basic concepts that are taught or that are mentioned in our text. So you can just listen to this introduction today, where some of the terms you may get familiarized with, so that in the further upcoming sessions, these terms when used will be relevant or understood by all of you. So moving into the class. So I'd like to start with a quick history of Ayurveda. So Ayurveda is considered as an Upaveda of Atharvana Veda, where few principles are or few references of Ayurveda have been mentioned in Upaveda. Few references have been mentioned in Atharvana Veda. So the origin of Ayurveda is roughly mentioned this way. So there are a lot of slight variations in the origin or how the granthas came about, but we will not get into the detail of that. So it is believed that Brahma Smritva Ayusho Vedam Prajapatima Jigrahat, so Ashwinavtau Sahasraksham, so Atriputradi Kanmuni. So it is believed that Brahma, the creator of the Jagat, recalled Ayurveda Shastra and transferred it or perceived it, and it was passed over to Daksha Prajapati. So it should also be known that up to Indra or Bhagavan Dhanvantari or Bharadwaja, it was only given through Smaranam and Shravana Jnanam. That is, they were all only recollecting and reciting it, and it was only taught orally to everyone. There was no written format until quite some time. So from Daksha Prajapati, it was passed over to Ashwini Kumaras, who are also known as the Surya Putras. That is the sons of Surya Bhagavan. And it is also considered that Surya Bhagavan, that is Ashwini Kumaras, were the physicians of the Devaloka or the physicians of the gods. From Ashwini Kumaras, it went over to Indra. So from Indra, different medical schools have different hierarchies of how their granthas came into existence. So for the Sushruta school of existence, that is Sushruta Samhita, it is believed
Sorry
that
to
Bhagwan
interrupt.
Dhanvantri received it from Indra. It was
Excuse me,
then
ma'am.
passed over to Divodasa Dhanvantri, and then contemporaries of Sushruta like Sushruta, Aupadenava, Aurabra, Vaitarana, Gopura Rakshita, all of them started recording or writing of the Ayurvedic Shastra was done. So among all their contemporaries, Sushruta Samhita became one of the most famous and received grantha or even available grantham, and it is mostly concentrated on the surgical part of what Ayurveda had. And next, Bharadwaja received another school of thought, said Bharadwaja received it from Indra, and it was passed over to Atreya Maharishi, and then it was then handed over to his Shishya, who are Agnivesha, Bhela, Jatukarna, Parashara, Harita, etc. And all of them wrote their own granthas, which were Agnivesha Samhita, Bhela Samhita, Harita Samhita, etc. So some of them over a period of time are not available. And then it was believed that Charaka Maharishi learned it from Agnivesha. And then Charaka Samhita became one of the most popular and referred granthas. Then there was another school of thought which has slight variations, but it is also known that Atreya, Bhrigu, Vasishta, Kashyapa also learnt it from Indra, and among them, one of the most popular treatises became Kashyapa Samhita, which focused more on pediatrics or Bala Chikitsa, that is more pertaining to treatment for children. So why Ashtanga Hridayam is chosen mostly in all the concepts is because all the Aditas are vast, complex, and have a lot. If you have gone through Charaka, Sushruta, etc., they are all mostly in Gadya form. That is, they are in long, lengthy paragraph forms. Some of them are even in conversation form between a Guru and Sishya form. So when the Sishya asks a question, the Guru replies in a long paragraph form. Sometimes even what happens is the repetition of few concepts have been put in between for better understanding. So over a period of time, what happened was the retention or the grasping capacity of everyone started slowly reducing. So much of content could not be retained or memorized, or it started becoming slightly difficult, which is why Acharya Vagbhata compiled the Ashtanga Hridayam, which is a concise form of all granthas, but it is neither too brief nor too elaborate. It does not imply that some of the contents are cut. Some of the most essential forms are collaborated, and one of the main advantages of Ashtanga Hridayam is it is in Padya form. That is, it is in a poetic form. Most of them will be in a two-line shloka form, which makes it very easy to understand and also easy to grasp and retain. So as Ayurvedic physicians or doctors, there are a lot of shlokas or there are a lot of content that actually one has to retain in memory. So when it became into a Padya form, retaining this became very simple. So moving on to the branches of Ayurveda. So Ashtanga Hridayam has mentioned mainly Ayurveda covers 8 branches. It's about what Ayurveda can cure, what treatments are available in Ayurveda, or does Ayurveda even have treatment or references for all of this. So these will cover those points. Say Kaya Bala Grahor Dwanga, Shalya Damshra Jaravrishan. So mainly all the diseases overall are divided into 8 branches of Ayurveda. So coming to Kaya Chikitsa, roughly correlated to general medicine, that is Sarvanga Samshritanam Vyadinam. It includes diseases covering all angas, Sarvangam of the body. So some of the common, we can correlate it to what is currently known as general medicine, but it is also slightly more than that. It includes treatments like Jwaram, Kasam, Shwasam, Atisaram, that is all sorts of fevers, cold, cough, respiratory disorders, or any GIT related disorders like your vomiting, loose motions, diabetes, skin related disorders, anything that is generally affecting the body comes under Kaya Chikitsa. Next, coming to Bala Chikitsa. As the name suggests, Bala, it refers to the pediatric age group. So according to the Samhitas, up to from 0 to 16 years of age, they are considered as Bala. Also, it not only stops with treatment of Bala, so 0 to 6 months of age of a child is considered very crucial, where they are exclusively breastfed and everything to the child is got only through the breast milk. So Acharyas have not only given importance to treating the child, but also it includes detailed description of treating of lactating women, treatment of breast milk, or any vitiation or complaints in the lactation of breast milk of the mother is treated under Bala Chikitsa. Some of the acharyas even start the treatment of children in the Garbha Avastha, that is from pregnancy. A lot of medicines and treatments or medicines are given for the pregnant woman, keeping in mind the health of the child. So also, since 0 to 6 months, the child is exclusively breastfed and nothing external is given. Ayurveda always treats any disease or any illness of the child from 0 to 6 months by giving medications or treating the mother, because it is always believed that through the breast milk, the medicines go to the child and the effect of the aushadhi reaches the child via breast milk. So that all those are covered under Bala Chikitsa. Then Graha Chikitsa includes psychiatry or all kinds of mental illnesses. So today there are a lot of modern terms, a lot of diagnosis of this given. So roughly, Graha Chikitsa includes some neuro-related disorders like even epilepsy or some neurocrine disorders, and also mainly psychiatric disorders related to the mind. Then Urdhvanga Chikitsa includes all diseases above the neck. So urdhvam means above the neck. So roughly it is can be correlated to ENT, but it covers a lot more than that. So it includes Shravana, Nayana, Vadana, Granadi, Samshritana. That is, it includes all the diseases of the ears, eyes, nose, and the mouth, and also the neck, also the scalp, hair, all of them above the clavicle or above the shoulder is considered as urdhvangam. So all the disorders related to this are covered under Urdhvanga Chikitsa. And then Shalya Tantra. So Shalya Tantra is correlated to surgery, where any diseases related to surgical related procedures are covered under Shalya Tantra. Also, importance has been given by Sushruta, or detailed description has been given about wound healing or wound related treatments. So even in today's scenario, Ayurveda has excellent wound healing medications, or Ayurveda has very, very effective wound healing medicines. And also importance has been given to use of cautery, that is Agni Karma, Kshara Karma, use of alkaline preparations, and Rakta Mokshana, that is bloodletting therapies. So a lot of the surgical procedures that are mentioned in Sushruta Samhita may not be practically practiced today because of the development of modern surgical things, but surgery, anorectal cases still have a very, very good relief in Ayurvedic way of surgery. So all diseases like hemorrhoids, fistula, fissure in ano, there are still lot of good surgical practices implemented through Ayurveda, which are practiced in today's scenario from Shalya Tantra. Damshtra, the word literally means bite, so it can be considered as Agada Tantra or clinical toxicology. So it is nothing but treatment mentioned for bites of insects, snakes, or even artificial metallic poisoning, which is covered under clinical toxicology. Then Jara. Jara is nothing but old age, but it also is another name known as Rasayana Chikitsa. So it can be elaborated as Vayasthapanam, Ayurveda Balakaram, Rogopaharanam Samartham Cha. So it includes Vayasthapanam, that is maintenance of the health of a person. And it does not mean that you will never become old, is not the meaning of it. The transition from middle age to old age can be done smoothly by adapting Jara Chikitsa or Rasayanam. That is a more of a rejuvenation therapy, or the diseases that are necessarily meant to happen in old age can be avoided. Maintenance of the health can be done, and also using of rasayanas, immunity or maintenance of your immunity strength, improving your medha, that is your memory, intellect, can all be done through rasayana chikitsa. The last one, vrisha, is nothing but vajikarna, which mainly pertains to the male fertility and the complaints related to male infertility. So these are the rough branches that cover almost most of the diseases in today's scenario. So let us move into some of the basic concepts of Ayurveda. So even of people who don't have any idea about Ayurveda, so when they hear the word Ayurveda, what they think of is Vayu, Pittam, and Kapham. So what is Vayu, Pittam, Kapham? Most of them don't know, but they just know that Ayurveda has Vata, Pittam, Kapham. So let us understand slightly more. So Vayu, Pittam, Kapham are known as Tridoshas. So I will explain what dosha is. So Vayu, Pittam, Kapham are considered as Sharirika doshas, that is related to the physical body. So they are considered physically the doshas. Manasikam, the doshas related to mind are Sattva, Rajas, Tamas, where Sattva is considered the guna of the mind. It is not a dosha, where Rajas and Tamas are considered doshas of the mind. So first, what is dosha? So we said Vayu, Pittam, Kapham are doshas. So what is dosha? We will see. So dosha is nirukti is dush vaikrityam. That is something that is susceptible to vitiation. So vitiation is something that has a capability to get spoiled or that can go wrong. So that is why it is known as dosha, because it is always susceptible to get vitiated in the body. So this dosha in the body is assessed through its function in a qualitative way. So it is not quantitative. So one cannot show or measure what is Vayu, Pittam or Kapham physically. It is always assessed by its gunas, guna and karma. That is its functions and what qualities it possesses. So when in balance, when the doshas are in balance, your body is free from diseases, that is avikrita. And when they are not in balance, or when the imbalance happens, is when there is some disease that is caused in the body. So what happens is, any Ayurvedic physician that you go to, the first line of assessment will be which dosha is vitiated or which dosha is abnormally increased, is what they will try to assess in any kind of disorder, and treatment will be started accordingly. So dosha forms the basis of any kind of treatment or any understanding in Ayurveda. So let us move to a simple understanding of each and every dosha. So first, Vata dosha. So tatra vagati gandhanayo iti vataha. It is the nirukti. That is something that moves or can be known or felt, is known as Vata. So it is predominant of Vayu and Akasha Panchamahabhuta, and the functional or the qualities, the gunas of Vata are mentioned as Tatra Ruksho Lagushitaha Karasukshmas Chalonilaha. So how these can be understood is Ruksham, that is Vayu is Ruksham, that is it is drying in nature. So it causes dryness or depletion in the body. Lagu is Vatam is light in nature, owing to which it can easily move all over the body. Sheetam, it is cold in potency. The nature of Vata is it is Sheetam, that is cold. So this can be understood more clinically in terms of treatment protocols. That is, when people always suffer from any kind of Vata dosha or Vayu related disorders as assessed by the physician, then always Aushadis or food or medicine is given with slightly Ushna Viryam. That is, medicines and drugs are given which are heating. So definitely people find relief when something warm is given in a Vata dosha, because the Shita guna of Vata comes down. So that is how it has to be understood, the Shita guna of Vata. It is not that while touching Vayu, it is cold in nature, is not the concept here. And coming to Khara, then again, Khara means rough. That is Yasya Lekhana Shakti. That is, Vayu does something like a scraping nature in the body. Then again, it has the capacity to deplete. It is not a very nourishing in nature dosha. Sukshma means it is very minute. So because it is light, and it is very easy to move, it is so minute that it can move through even the minute channels and srotasis, or it can move all over the body with ease. There is no difficulty for Vayu moving. And as the next word suggests, chala, it can move easily in the body. So a lot of you might have experienced that when you have a bloating or an indigestion kind of complaint, you can feel Vayu move from one place to another, because it is very easily moving in the body. This is just a practical example that we feel. So it is clearly one of the gunas of Vata, where it moves very easily. So some of you may also have experienced, or patients have shifting kind of joint pains. So Vayu, when lodges in the joints, it has this chala guna, because of which it shifts from joint to joint, causing a lot of pain. Then Pitta dosha, the nirukti is tapasantape, that is to heat, burn, or create warmth. So tapa is something that is warm in nature. It is predominant of Agni Mahabhuta, and it has functional resemblance to Agni. So Agni here can be considered as a digestive fire of our body. So the main Pitta dosha karma would be dahanam, that is burning, pachanam, digestion, and all the transforming processes can be associated with Pitta dosham. So the gunas of Pittam in the body are Pittam Sasneha Tikshnoshnam, Lagu Visram, Saram Dravam. So unlike Vayu, which is Ruksham or dry, Pittam is slightly unctuous. Sasneham here means it is slightly unctuous compared to Vayu. It is sharp or very Tikshnam in action in the body. It is Ushnam compared to Vayu, which is Shitam. Pittam is having Ushna Gunam. So whenever you go with complaints of burning, redness, inflammation, or some of the common diseases like not gastritis, your sour belching or burning, which we call as amla pittam, chest burning, or even diseases like visarpam, which is nothing but herpes. The main symptoms will be redness, burning sensation, which clearly indicates that there is a pitta involvement. So at that time, an Ayurvedic physician will come back the Ushna Gunam of Pittam by giving you lepas or external applications or oils that are cooling in nature or made of drugs which are cooling in nature. Then again, Pittam, like Vata dosham, is light in nature. Then it is Visram, that is, it has a slightly unpleasant smell, and it is Dravam, it is liquid in nature, unlike Vayu, which does not have any form. And Saram, that is, it is free flowing. Because of its liquid nature, it can move in the body. Coming to Kapha dosham. Kapha dosham nirukti is Kena Jalena Phalati iti Kapham, that is, it is a product of water, or another nirukti of Jala that can be taken is here to hide or encompass. Another name of Kapha that is given is Shleshma. So another synonym of Kapham is nothing but Shleshma, which is nothing but Slish Alingane, that is something to keep or bind together. So what Kapham predominantly does is, it is nothing but binds, covers, or encompasses things in the body. So Kapha is predominant of Prithvi and Jala Mahabhutam, and mainly all the binding, the stability in the body, or all the bulkiness in the body is mainly got because of Kapha dosham. The gunas of Kapha are Snigdha Shito Gurur Manda Slakshno Mritsna Sthira Kapha. So it is snigdha, that is, it is well unctuous. That is, unctuous, I think all of you know the meaning. It is slightly greasy or oily. So Vatam is extremely dry, Pittam is slightly unctuous, and Kapham is extremely or well oily or greasy. That is how we consider Kapham. Then again, like Vayu, Kapham is Sheetam or cooling, and it is Guru because it is predominant of Agni and Jala Jala and Prithvi Mahabhutam. It is Guru or heavy in nature, owing to which definitely there's something heavy. The movement of it is slightly slowed. So Kapham does not move as fast as how Vayu can move in the body. So it is always believed that Vayu is the carrier of all doshas in the body. So Vayu, due to its nature of Chalaguna, can carry Pitta and doshas to other places in the body. As such, Kapham cannot move with such great speed. Slakshnam is, it is very fine and smooth, and it is slightly sticky in nature. And Kapha is something that provides sthiratvam or stability in the body. So all the stability in the joints, the muscle bulkness, or the steadiness and stability of our body is only because of the Kapha dosham that is present in us. So moving on to so in the first slide we have told that Vayu, Pittam, Kapham have to be in balance to prevent any kind of disease in the body. However, there is a natural variation in doshas during some parts of the day, night, age, and food related aspects. This, however, does not cause any abnormalities in the body. By nature, there is a slight variation of these doshas through the day and night. So let us go through that in brief. So during the day, so the early mornings are considered as Kapha kalam. I think you can see here. So coming to day, the early mornings are when there is a slight predominance of kapham in the body or in nature. So roughly it can be correlated to early morning 2:33 a.m. to around 6 7 p.m. 7 a.m. in the morning is where there is a slight increase of kapham in the nature. So one of the practical correlations that is done is one of the important panchakarmas in Ayurveda is vamanam. That is an induced vomiting cleansing, which is done predominantly in kapha pradhana vyadis or to expel excess kapham in the body. So if any of you have undergone or have heard about it, always vamanam will be done in this timing. So roughly it will be done between 4:30 to 6 7 in the early morning, because generally itself kapham will be slightly on the higher side by nature, and due to this high increase in a slight increase in kapham, the vamanam procedure happens with slightly more ease because it is done in the kapha kalam. So that is one practical correlation why always vamanam is done in the early mornings. That is, the main aim of vamanam is to expel kapham, and when it done in kapha kalam, it is done with more ease. Then as the day transitions, say post 8:39 10, then slowly it transitions to pitta kalam, where the midday has a slight dominance of pittam. So then another panchakarma, that is virechanam, that is induced purging, that is done, is predominantly done for pitta pradhana vyadis. That is, if you're suffering from if a physician decides to give you a virechanam, so he would preferably do it post 9 9:30. That is, once the kapha kalam comes down and the pitta kalam comes, so that the main aim is to help remove pittam, so the treatment happens with ease in the pitta kalam. So slightly towards up to 2 or 3 in the afternoon, there is a slight pittam that is there predominant, and then post that in the evening again there is a transition to slight increase of vatam, that is about 2 or 3 p.m. to up to sunset, say 6:30 p.m. Then there is vata pradhanatva. Moving to the night, as soon as there is sunset, the early vata kalam, that is the early kapha kalam, starts. That is say around 6 p.m. to 10 p.m. the early kapha kalam starts. So up to from 6 up to 10:30, roughly I'm giving you the timings for easy understanding. It is not exactly that by 10:30 kapha kalam will come down. So as soon as there is sunset, the it is believed that the night time starts. So early night time there is kapham that is slightly predominant. Then by 10:30 11 in the night, the pitta kalam starts up to 1:32 say 1:32. There is a slight increase in pittam in the midnight, and extreme late nights, that is 2:30 up to the next day early morning, or you can consider it to be vata kalam. So the importance for this is given can be seen in practical correlations with sleep. So we will in further PPTs cover about nidra, that is sleep. So what is the importance given to what happens when you do late nights, what happens when you do day sleep, and all is mentioned in great detail in Ayurveda. So because there is an increase of vata dosham in the late nights, there is already a slight increase. We practically see in our practice that people keeping up late nights, that is sleeping at 1:32, or staying up late nights, people working in night shifts, always suffer from some kind of vata related disorder, because already at that time vayu is in a slight raise, and again doing activities or being active in the vata kalam increases vata more in the body. So we see a lot of people keeping up in the night complaining of abdominal bloating, distension, constipated issues, or joint complaints. All those diseases that are related to vata dosham are commonly seen. So Ayurveda does not only emphasizes on just any 6 or 7 hours of sleep, but what time you sleep is also extremely important. So this we will cover in the coming chapters. Moving to age. So in childhood or bala avastha predominantly, there is a slight increase in kapham. So when we see young children, predominantly there is a slight kapham in them. So which is why you can also correlate to some clinical thing that they are more prone to kapha related disorders. That is, they can catch cold or cough easily. Their respiratory disorders are more common, and also worm infestation is very common, because when there is an increase of kapham in the body, and also as children, the intake of other kind. So mostly they tend to eat a lot of sweet or less spicy kind of food, which also adds to the mild increase of kapha. So we can practically see children have a lot of common complaints like frequent cough, cold, worm infestation, lot of phlegm building. This is because already in that age, the kapha will be slightly in increase, and as they age, they tend to um, outgrow that. So when you come to the middle age, that is your teens and up to your 20s, 30s, etc., the pittam is slightly more. So this is where the youth or the middle age, there is a slight increase in pittam, where we see that because of slight increase in pittam and good metabolism, you get through most of the wrong habits that you do. So it does not affect you much. One is because of your age, two is because whatever you do is carried forward. And also we see this acne breakouts or skin related pimples and breakouts come when there is a slight transition from childhood to teens, because there is a they enter into a stage where pittam is slightly elevated, and once they enter into the transition to old age, that is between 45-50, then the Vata kalam starts. So most of the old, when you transition to old age, is when they start getting vayu or joint related disorders. Say they start complaining of knee pain, or they start losing weight, or they complain of constipated issues, or their digestion is not very great. So all this happens generally itself because one, they are transitioning to old age where the vayu in itself will be slightly high, and also if they are unknowingly practicing some regimens and diet that increase vatam further, then it tends to bother them more. Then coming to food, this is just a translated phase where the initial stage of digestion, kapham is more. In the mid stage of digestion, pittam is more. And in the final stage of digestion, where there is a assimilation and formation of fecal matter, vatam is more. So this food aspect will be dealt with in detail in the coming chapters, because aharam is going to be dealt in greater detail. So next, coming to what are the types of Agni generally that we have, is mainly 4 types. But so Sama Agni, the last one that I've mentioned here, is when there is an equilibrium of all the doshas, then the Agni, that is the predominantly here Agni is referred to the digestive fire of the person. So what are the different abnormal types of Agni that we see? One is Vishama Agni. Vishama Agni means the digestion is very inconsistent. That is, sometimes they have good digestion, sometimes they have impaired digestion, sometimes they digest well, sometimes they get easily indigestion complaints, all that happens. So this is predominant when vayu dosham is predominant, either when the vatam is increased, or when they have a vayu related disorder, or by nature in old age generally they tend to have this slight vishamagni. Tikshnagni is when the Agni or the digestive fire is very sharp, is when it is Pitta Pradhanam. So impact on digestion is they tend to digest the food quite fast, or they take a much shorter time to digest their food than other people. Mandam, that is in Kapha Pradhana conditions, or even when you have any Kapha related disorders, say fever, cough, cold, or lot of chest congestion, phlegm, or even for that matter, rheumatoid arthritis, which is correlated to what we call amavatam. That is when there is an increase of kapham in any way in the body. So the digestion there itself becomes less or hampered. So generally when we have a severe chest congestion of phlegm, we don't feel that hungry. That is because when the kapha dosham increases, it makes the agni very mandam or dull, which impacts the digestion. Dull here would mean it takes a much longer time to digest. Say if ideally a person would take 2 or 3 hours of time to digest food, the kapha dosha, or when there is a slight increase of kapha, people take longer to digest food. So even after having 4-5 hours gap between having breakfast, they are not ideally hungry by lunch. They still feel it's very dull, and they still feel the food is there in the stomach. That is because of the mandagni, which is caused by the kapha. So samagni is when Agni is in equilibrium, there is no digestive complaints. So in the further PPTs, when we go through Aharam, there will be a clear description of what proper Jirna Lakshanas are. How do you know your Agni is functioning properly will all be covered. So this is just some basic theoretical terms that I would like to mention before we start. So Koshtam here refers to bowel movement. So Koshtam here refers to the bowel. So we generally see that there are predominantly three types of bowel that are seen. So this concept is more important and relevant to practicing physicians and has to be given importance. So in generally Vata Prakriti person, so next further slides we will know what Prakriti is. So generally when Vata dosha is high or in a Vata predominant Prakriti person, the bowel is krura koshtam. That is, it is slightly hard. That is, the person has to put in some effort or strain to pass his bowels. Pitta Prakriti person is where they tend to have mridu koshtam, that is soft bowels, that is even mild laxatives like say milk or sugarcane juice, etc. When consumed in slightly more quantity can give them an easy bowel. So that has to be assessed as a mridu koshtam. And when they are in Kapha Prakriti, that is, it is an optimal kind of Prakriti where their koshtam or bowel movement is madhyamam, that is somewhere between kruram and mridu koshtam. So this has clinical importance in terms of practice. Say when we are giving some kind of panchakarma or virechanam, that is purging kind of medicines, assessing the prakriti of the patient is extremely important here. That is assessing their koshtam. So if a mridu koshtam person, say a person who has a mridu koshtam is given a very sharp or strong purgative, then he ends up having extremely excessive purges and it becomes a complication. Similarly, Krura someone who's having a very hard bowel, is given a very mild medication, then he will not at all purge. So the whole purpose of the treatment will not be served. So always a physician assesses what koshtam you have before giving any kind of medication to you. Coming to Prakriti. So Prakriti is nothing but can be translated as constitution of the body. So most of the patients who come will always want us to tell them, please tell us what our Prakriti is. Please tell us what our Prakriti is. So the assessment of Prakriti is a detailed one where there is a huge number of points that we have to go through. But what is this Prakriti is what I want to explain here. So it can literally be translated as it is nothing but the constitution of the body. That is what it is made up of. And this constitution is nothing but the doshas in the body. So it is nothing but Vayu Pittam Kapham that makes up our body is what forms the Prakriti. So the Prakriti of a person is decided and inherited by the person at the time of Shukra and Artava Samyoga. That is, it is at the time of the formation of your embryo. That is when the sperm and the egg fertilize and your embryo, that is your garbha, is formed. It is already your Prakriti has decided at that time. So one, it cannot be changed. You already inherited in the Garbha Avastha. So it is present with you from the time of birth up to death. So Prakriti is something that you cannot change and you can just be aware of. So it is a non-pathological state. That is, you can ask that some of you may be a Vata Pitta Prakriti, then if there is a high increase of Vayu Pittam, then won't it cause problem? So this Prakriti, where there is a different prakritis are considered non-pathological. So acharyas give a very beautiful example where the snake, which is a venomous snake, stores poison in it. Just like how the poison present in it does not become poisonous to it or does not cause harm to that snake. It is present in it, but it causes no harm to it. Similarly, in Prakriti, the doshas are in non-pathological form. It does not cause harm to the body. So what are the types of Prakriti? This is a very rough chart, which is Ekadoshajam. That is a single predominant Prakriti. Dvidoshajam here includes predominant of two doshas, and Samadoshajam is when all the three doshas are equally present in your body, is Samadosha Prakriti. So it is very, very rare that you can see a person with Samadosha Prakriti where Vayu, Pittam, Kapham are all in equilibrium. So such people will have very, very good health status, will have hardly any illness. So this Dvidosha Prakriti is where either two of them, Vayu, Pittam, Kapham or Kapham, Vayu, will be slightly equal in power with each other. The other one will be slightly less. Then again, the assessment criteria is very, very large, but I'm just mentioning the types to you. And Ekadosha Prakriti, that is Kevala Vatam only Vatam, only Pittam, only Kapham are very, very rare to be found. So a person cannot be extremely Vayu and Pittam Kapham less, but there can be some cases. Majority of the population are found to be Dvidoshajam. So it is this concept why when there is Vayu Pittam or Pittam Kapham in equal, it is considered not a very great Prakriti. So worst is it is not, that is because you are more prone to getting disease if you're a Dvidoshaja Prakriti, but unfortunately, majority of the population will always have a Dvidoshaja Prakriti. That is, two of the doshas will be slightly more than the other one. That is because the treatments or the medicine that should be given should always be in balance. So Vata Prakriti, that is, if they are Kevala Vatam, it is considered Heenam. That is a very, very poor kind of inferior kind of Prakriti where they will be more prone to diseases because as I told you, the gunas of Vata are it is drying, it is very depleting in nature. So there is hardly any nourishment. So they will be more prone to getting any kind of diseases. Kevala Pitta Prakriti is moderate, and if they are well Kapha Prakriti, that is high on only Kapham, it is considered as a most Shreshtam or best Prakriti because Kapham provides stability, spiritvam, and wellness and roundness of the body, and also Kapham to some extent related to the immunity power of the body. So they will generally have a more good withstanding capacity than the other Prakritis. So this is just a basic uh, chart of what are the types of Prakriti available. Majority of the population would fall under Dvidoshajam, that is predominant of two doshas, and it is something present from birth to death. It is decided at the time of your Shukra Artava Samyogam, that is your fertilization of the sperm and ovary, and it cannot be changed. But knowing it, will know that if we are predominant of say X and Y, Vata and Pitta Prakriti, then further doing activities or doing some things that increase Vayu and Pittam will make us more easily prone to getting Vayu and Pittam related disorders. So this is a basic idea of Prakriti. Then coming to one more concept in Ayurveda, it is called Shad Rasas. That is, Ayurveda mentions 6 rasas. So what are its importance, how it affects the doshas will all be dealt in the further classes. There is a class exclusively for Shad Rasas and its importance. So I am just giving you the names now. So it is Maduram, Amlam, Lavanam, Katu, Tikta, Kashayam. So Maduram it is sweet, Amlam sour taste, Lavanam salty, Katu is acrid or spicy, Tiktam is bitter, and Kashayam is astringent. These are the most common tastes. So how they should be taken, in what moderation, what happens when excess of one of the tastes are consumed will all be covered in the further PPTs. Then coming to Virya. Virya is nothing but, it can be translated as potency of a dravyam or a substance. That is how a substance acts on our body. So there are a lot of variations about different kinds of viryam. Different acharyas have mentioned, but here mainly we are taking viryam as two types, that is Ushnam and Sheetam. So the potency or the factor with which a substance acts on our body can either be Ushnam, heating in nature, or Sheetam, that is it can be cold in nature. So since mainly we are pertaining to Aharam, food and dietary regimens, we will pertain to that. So all the medicines will also have Ushnam and Shita Viryam. All foods that we consume will also have a Viryam. Either it will be heating to the body or cooling to the body. So some very basic examples given here are Shita Viryam will include Kshiram, that is milk, Gritam, ghee, Annam, that is rice. All of these are Shita Viryam, cooling in nature. Ushna Viryam will include fish, that is Matsyam. Kulattam or horse gram that we consume is Ushnam or heating to the body. Dadi, curd, is also Ushnam to the body. So when we come to the Aharam chapters, knowing of which is Ushnam and Shita Viryam of food becomes very, very important, because many people may be having a lot of, they keep saying our body is very heated. Some of them have a lot of pitta related problems, and some of them may have bleeding disorders. So all this would be related where they will not know the reason. I am consuming so and so, but I'm still having all these complaints. Even after taking medicines, my complaints are not reducing. So that is when we have to assess the aharam consumed by the person in detail. Continuous consumption of ushna aharam and at the same time taking medications for that will not give you relief. So what we eat, knowing the virya of that is extremely important. Coming to vipakam. Vipakam is
Excuse
a
me, ma'am.
term. Yeah,
Yeah, 3 minutes more.
yeah, I'll just, yeah.
Yeah.
So vipakam is nothing but the end state or end product of digestion. So whatever we consume, whatever food we consume, in whatever six rasas that we consume, ultimately become or convert into these three vipakams. That is the end product of digestion, where it is predominant of madhura rasa. Anything that we consume sweet turns into madhura vipakam. Lavanam and amlam, that is salty and sour, becomes amla vipakam. Katu tikta kashaya rasam, all the three, whatever you consume spicy, bitter, will become katu vipakam. So this is keeping in mind where madhura vipakam balances the kapham in the body, amla vipakam balances the pittam in the body, again katu vipakam balances vata. So you can just understand this for now. When we go into shad rasas, I will explain to you the correlation between the doshas and the rasas. That is the how doshas and the tastes are correlated with each other. So it is very important to have a meal with all the six rasas in it. Then Desha is nothing but, as you know, Desha means place. It's broadly divided into Deha and Bhumi Desha. Deha is regions in the body, which we will not be covering here. Topographic regions have some importance for regular understanding. So broadly, Bhumi Desha, that is the topographical regions, are covered as Jangalam, Anupam and Sadharanam. So Jangala Desham is nothing but a place which is very scarce in water, has a lot of scanty trees and plants, or the plants, vegetation and animals growing there require very little water to survive or to grow. So predominantly the desert regions or very dry arid regions are considered as Jangala Desha. Then again, the plants and animals or even the people living in Jangala Desha will have a slight predominance of Vata dosha in them. The clinical importance will be mentioned in the further PPTs, but I would just like you to get familiarized with what is Jangala Desha, Anupam and Sadharana Desha. So in Jangala Desha, there will be a slight predominance of Vayu. Anupadesha, where there are plenty of water bodies, thick forest, absence of wind and heat of the sun. So it can be considered as the forest regions or the ghat regions or the coastal belts of the lot of coastal belts where it is thickly, densely covered with vegetation and a lot of water bodies are there. So organisms, the animals or the plants and the animals growing here will have a slight predominance of kapham in them. Sadharana Desham is a balance of both. So Pitta Desham as per se has not been mentioned because it is unfit for human inhabitation, because in such hot temperatures nobody can survive. Coming to method of treatment in Ayurveda, it is broadly divided into Shodhanam, that is purification, and Shamanam. So Shamanam is through medication, where you go, you are given kashayam, tablets, churnam, or different kinds of medication and cured. So when a physician chooses to do Shodhanam is, even after taking shamanam, there is no relief or there is only temporary relief. Then we go to purification or shodhanam, where it prevents recurrence of the disease and helps to eliminate the disease from the root. So acharyas give a very, very beautiful example that when a sapling is very small and planted in the soil, it is much easy to pull off than when you allow it to grow into a tree and the roots become very deep rooted. Pulling out a tree is much more difficult. So which is why Ayurveda as such is not slow, but what people do is come after 5 years, 10 years, 20 years of complaints, when the problem becomes so deep rooted that there is no option of shamana chikitsa. So at the onset or very beginning of a disease, if you come shamanam or just by giving simple medication and diet changes, you can get cured of the illness. But when you don't undergo that, there are different kinds of shodhanam, that is purification, mentioned for different ailments. But I'm not going into the details. I will mention what the 5 panchakarmas are. So vamanam is induced vomiting procedure. Virechanam is an induced purging procedure. Vasti is a medicated enema that is given. Nasyam is administration of medicine through the nasal passages. And Raktamokshanam or bloodletting is considered as one of the Shodhanam or Panchakarma by Sushruta. So mainly these 5 are the ones that are commonly practiced. Then Chikitsa, that is for these are treatments for physical ailments. Ayurveda has also given equal importance to mental illnesses or preventing or chikitsa for the manas. So, di dhairyatmadi vijnanam manodosha aushadam param. So, excluding all the medications, tablets, treatments that are given for the mind, building of di, that is the intellectual power or developing of your buddhi, is very, very important. Dhairyam, building of confidence in oneself, and atma vijnanam, that is knowledge of the self, orientation of the self, or why we are there. So there are a lot of methods that were mentioned in our olden days, that is reading of scriptures, doing of puja punaskaram, reading of lot of granthas were giving a lot of positivity. They would always emphasize on developing of the buddhi, which was one of the main reasons why in the earlier days there were lesser number of manasika complaints that were there. So in current scenario, this has to be given a lot of importance along with medication and treatment. Mental Dhairya Atma Vijnanam is important for the mind. Then coming to what Ayurveda discusses about diseases is, they are broadly classified as sadhyam and asadhyam, that is curable and incurable. So curable would either again be divided into sukha sadhyam and krichra sadhyam. Sukha sadhyam is cured easily. So this again, when you come at the start of any disease, definitely Ayurveda can give you a lot of relief. People do not have to understand that only if you come after 5 years of joint complaints or any other illness, Ayurveda has treatment. Immediately, if you get any kind of disease, fever, cough, cold, loose motion, for every kind of treatment, Ayurveda has chikitsa or medication. So sukha sadhyam is when it is easily curable. Krichra sadhyam is when there has to be an effort put. So treatment, panchakarma, shodhana, or some surgical procedures have to be done and the patient gets cured. In asadhyam, it is again divided as yapyam and anupakramam. Yapyam is it cannot be cured, it just has to be managed lifelong through medicines, diet, and pathyam and lifestyle changes. So this would include diseases like diabetes or psoriasis. So then again, if you come in the early stage, it is completely curable. There are some in our text that are mentioned that if the disease cross certain number of years or certain number of months, it becomes yapyam. So at that time, you just have to maintain it. Anupakramam is nothing but such kind of patients should not be taken for treatment because there will not be any relief or it cannot be helped. So this is how Ayurveda classifies the disease pattern. So these were some of the basic concepts that I wanted to share in the first class. So further on in further sessions, we will be having Dinacharya, Ritucharya, that is daily regimens mentioned, seasonal regimens, what are the changes we need to make according to each season, properties of different food items that we consume, detailed discussion on aharam, incompatible food, that is viruddha ahara, what mistakes we make while eating, what Ayurveda has told about food and eating, and shadrasas, that is influence of the tastes on the body. So further on, this will be covered, and I'm sure you will be able to correlate what we have discussed today when we go through these chapters. Thank you. And if there are any doubts or queries, you can always mail us through this. And I think now we can go into the, if there are any queries or clarifications or anything that has to be repeated, I think you can ask. Hello?
Yes, ma'am.
Yeah.
You can answer for the Q&A or anybody raise hand.
Yeah. So I'll just go through the chat session. Any feedbacks that have to be given can also be done, will surely be implemented. And I think, one second. So all the slides and the content matter will be definitely given to you at the end of the session. So one second. So, okay, I think next time I'll go a little slower. And 1 second, this doubt session is moving too fast. 1 second. So then again, so so any question can be put relevant to the session. So I would not be able to answer personal questions, that is what is my prakriti or what I can do. So you can kindly consult an Ayurvedic physician nearby or you to help understand what your prakriti is or how to get about your this thing, or by the end of the session you will definitely understand better. All the content and slides will definitely be shared. So how to identify one's prakriti? Then again, I told there is a long assessment sheet that is done. So you can definitely consult any Ayurvedic doctor or physician nearby. There is a long assessment sheet and criteria with which you will definitely be able to identify it. So there is no consolidated reference for the terms. You can always go through Ashtanga Hridayam or make a note of this PPT that is used. So, or repeatedly as and when we go about the chapters or by the end of the session, you will become familiarized with these terms. So 1 second, it is moving quite fast. Can I, so So kindly refrain from asking personal or related questions or medically related questions, because it has to be the forum has to be respected for all the participants. I cannot be answering individually health related questions. So you can kindly consult or refer to any Ayurvedic physician. They will be definitely be able to help you. So any question in between I have missed? Anything that has to be repeated, you can let us know. And we have mostly written everything in English or the Devanagari script because we have kept in mind people who do not know to read or understand Sanskrit as well. So that is the only intention. So So someone has asked, what is the difference between Virya and Vipakam? So Viryam is nothing but potency of a drug. That is potency of a dravya. Whatever food or medicine that you take will have a Virya. That is potency. How it acts on your body. Either it can be cooling or heating is what is Virya. Vipakam is nothing but the end product of any food that you eat. What is the end product of digestion? So whatever 6 tastes that you consume will all get converted into Maduram, Amlam, and Katu Vipakam. That is, they become these three rasas. Then again, when we go into the detail of Shad rasas, I can explain better that when there is a Madura rasa, there is a balance of Kapham, because Maduram always increases Kapham. Amla rasam, that is sour taste, always balances Pittam, is good for Pittam. Katu rasam is good for Vayu. So I think that is why when we go to the Shadrasa class, you will understand why these tastes are the final this thing. All the recordings and PPT will be got, so you can always keep them for your reference. Any reference of book, you can always buy Ashtanga Hridayam. There are a lot of Hindi comment translations or English translations or even Tamil translations. You can always go through them. It's very simple and easy to understand. So rheumatoid arthritis is a kapha dosha you mentioned. So I just mentioned it very vaguely. So rheumatoid arthritis is it is just correlated to what Ayurveda deals as amavatam, which is a detailed description of the disease. So I will not go into the disease part of it. Definitely all the three doshas will be vitiated, but Vayu and Kapham are vitiated in amavatam, that is rheumatoid, which is why I gave you that example. So then again, what dosha people should take Maduram when we deal with the the chapter on tastes or aharam food, you will definitely understand better. So all 6 rasas should be taken by all people in balance, which will be explained in the further chapters definitely. So as Ashtanga Hridayam, the text will be in Sanskrit, but you also have translation and meanings in different language books. So I can refer to the names of some books and get back to you in the next session. So Ashtanga Hridayam is definitely, Ashtanga Hridayam is a textbook. So I think someone has asked, what does Ashtanga Hridayam mean? So it is nothing but a textbook like Sushruta Samhita, Charaka Samhita, Kashyapa. These are all texts of Ayurveda. A more concise form of Ayurvedic content is Ashtanga Hridayam, which is one of the compiled form of all the elaborated versions. So it is very easy to understand. So will you be giving guidance regarding, so Nadi Pariksha will not be covered in this chapter because that is more to do with a physician related, or if there are doctors or something, it will be related, because one Nadi cannot be seen through online this thing. So I don't think that will be covered. So does consuming 6 rasas in balance? So when we go to the detailed discussion of Aharam Viharam, you will know that Ayurveda does not look at food through protein, carbohydrate, vitamin, minerals. So once we go through that, consuming a balanced Aharam based on Dosha, Prakriti, nature itself, your health will be at a very optimum level. So then again, that doubt could be clarified as and when the classes move about. So how many weeks this class? So I think it will be conducted for 9 or 10 classes are there. So again, no personal questions. So knee pain due to Vata. So all diseases have treatment. Just for understanding, I gave you practical correlations. So definitely there is treatment for all kinds of diseases in Ayurveda. Any other doubts? Have I covered most of the doubts, or if I've missed anything, you can kindly raise your hand, unmute and ask me, because I think the slides, the chat box moved very fast. So 1 second. Message. So what kind of Desha, Himachal Pradesh? So mainly because of its mostly cold nature, snowy nature, we can consider it slightly to be in the Anupadesha region. So is there any correlation between? So naturopathy, Ayurveda are almost similar. There is some chapters or some parts of it can be correlated, but not most of it. So will we get guidance to balance our doshas? Definitely. That is the main aim of this basic course of Ayurveda course, where through Aharam, Viharam, your dietary changes, your regular day-to-day routine, how we can prevent this imbalance is what we are going to deal with. So if someone has Pitta Prakriti predominantly, if Vata increases in old age, so that's what, if you're Pitta, so that's what I said, Prakriti cannot be changed. So if you're a Pitta Prakriti, until we die, we will be the same Prakriti. But what happens is, in old age, generally there will be an increase or tendency of Vayu to get increased. And at the same time, in old age, if we have food or do regimens and diets that increase Vayu, definitely we will end up getting a Vata Rogam. It does not mean all people in old age have to definitely get Vata Rogam. Only when something is done wrong, we get Vayu, but the Prakriti will not change. So then again, when we go into the further chapters, you will know what food or what habits that we do increase Vata, what increases Pitta and Kapha. So Ayurveda has both internal and external applications, or only it has application treatment aspects. So we will not be going into external applications, or a medicine form of it will not be covered. Only related to food and diet or regular regimens will be covered here. No medically related medicines, oils, and all that will not be discussed here. So you need not procure any book or anything. You can just make note of these classes if interested, and you can always get back and refer to Ashtanga Hridaya, which is where most of the references I have taken. So how to find out which dosha is high in the body? Then again, it only depends on if you have any certain related complaints. So if you have certain ailments or illness, if you go to an Ayurvedic physician, based on your complaints and lakshanas, they will assess which dosha is high. So what I have told is only the properties and qualities of the dosha. What symptoms they show when the dosha is high has not been discussed, which is more related to a physician's point of view. So if you're studying Ayurvedic medicine or this thing, or Ayurvedic science, so when Vata dosham is high, what lakshanas or symptoms the patient will exhibit will be known to the physician, and that is how it is identified. That is how it is done. So if there is any problem that you have, when you go and consult, you will know which is vitiated. So I think some of them raise their hands. If you want to unmute and question, then I think in the question answer session. Have I missed any queries? Kindly let me know. Uh, So someone has asked, can you repeat first three slides? I think currently some time is insufficient. So I think I've just mentioned about the basic history of Ayurveda, how Ayurveda came into existence, and just the branches of Ayurveda. So I think you can go through that once you get the PPTs and recordings. If it's still not understood, then maybe in the last session when we have some time, we can go through that again. So if is Madhu, so someone has asked. Hmm. So I think someone has asked, is madhu or honey kashaya rasam? Yes, actually pure honey is not sweet in taste. It has to be astringent or slightly kashaya rasam, which is one of the main important qualities of honey. That will again be discussed in the Shadrasa class. So then again, yeah. So most of the doubts that are relevant to this PPT, I think we have covered. If there's anything else, you can. So you said Rajo and Tamo are doshas, are they not gunas? So manasikam wise, Sattvam is considered as a guna and Rajas and Tamas are considered as the doshas. That is, Rajas and Tamas are those that are capable of vitiation. Then again, in Manasika Chikitsa, detailed qualities of these will be there. So in a Rajo, if it's high, what are the problems that are caused? Tamas, when it is there. So I think if you're familiar with Bhagavad Gita, or if you go through some of those scriptures, what are the qualities of Sattva, Guna, Rajas, and Tamas are mentioned in the 12th chapter of that. So it is not a very ideal state of mind, Rajas and Tamas. So definitely at some points it might be slightly high, but predominantly having Rajas and Tamas as a manasika faculty is not very good. Ideally sattvam is what is mentally needed, so that is why it is considered as a dosha. And are all joint pains due to vata? Then again, this is I think a very medically related question, so you can just consult a physician or always get back outside. Can mental disorders be treated? Yes, it can be. Pronunciation. Okay, I think I'll slow down the class from next time, but I think it has to also, we have to cover some topics. So yeah, is there anything else? People can unmute and ask now, or if I've missed any question, you can kindly ask me again. Yeah. Nagashri ma'am, I think someone is asking how to unmute. There is no option. So, So what is the difference between Ashtanga Hridayam and Ashtanga Sangraham? So Ashtanga Sangraham is further concised into Ashtanga Hridayam. So the Brihatrayis, the three main texts of Ayurveda, Charaka, Sushruta, and Ashtanga Hridayam, which was written by Vagbhata, where Charaka and Sushruta Samhita and other granthas were concised as Ashtanga Sangraham. Further from Ashtanga Sangraham, they concised and made it Ashtanga Hridayam. I think all of us are so. Ma'am, I think they're asking you to unmute. So question and answer. So attendees can chat. Unmute facility. 1 second. So I will check if we can unmute. Nagashri ma'am. 1 second.
Ma'am, can you
Ma'am, I can't hear you.
can you click on participant?
Yeah, some people are saying they're unable to unmute. So
Yeah, click on participant. You can
ma'am, you're not audible.
ma'am, you can click on participants.
You can click on
Yeah, participants.
participants. Okay. And so attendees, I think.
Hello, panelists too.
Ma'am, can you unmute them? Because you're also
Yeah.
a host.
Yeah,
Yeah,
now it is clear, ma'am. I have unmuted.
okay. Okay. So I think if there's any doubt what people want to ask, then you can think ma'am has unmuted the option.
Now they can talk.
Yeah. So I think people who have raised your hand, you can unmute and ask your doubts. So 7 participants. Is there anyone who would like to unmute and ask? Or we can wind up the session because we've already passed the time. So, chat again. Ma'am, I think everyone has been, yeah. I think again someone has,
I think now I'm able to unmute it.
Yeah.
Okay. No, so can we extend this session by half an hour, like 8 to 9:30, or can we do like instead of 10 sessions, can we do 14 or 15 sessions so that we can go on slower pace and then cover some of the doubts so that everyone understands?
Yeah, so the content that we have mostly covered is 10 PPTs, I suppose, but we can extend the time always. I can go a little slower, and it has anyway extended to 9:30 now. So maybe I can further slow down the pace, and we can extend it by another 15-20 minutes. That should not be an issue. So if I've missed anyone's question and answer, you can please type it again. I must have missed through because it keeps scrolling. So all the classes will be conducted every Sunday. And in case there is a time shortage, we can always shift it to a next class. like I think sir
Prashant,
has asked.
they have raised their hand. Mr. Prashant.
Yeah,
Yeah.
good morning to all. Thanks for this session. I just wanted to check. I had posted a few questions in Q&A section. Are you able to see that? Because this would actually help us in, posting the questions separately in the Q&A section.
Okay, I think there are almost 90 odd questions.
Oh,
If you
okay,
can
okay. Then
repeat,
okay.
yeah,
I will
I think
just
I've missed
repeat it.
all.
I understand. Okay. Then.
Yeah.
So I just wanted to, check with you. Is Tikshana and Jatra Agni the same? That is one thing. And then I wanted to know the difference between Purusha and Prakriti. And then third one, important one is I just wanted to request you whether you can suggest any book for Ashtanga Hridayam by Tamil author who has given a very good
Okay,
explanation in Tamil maybe.
fine.
Yeah.
So I think that I will get back to you. There is a Tamil translated book. I will just get back to you on that name for the translation and the meaning in Tamil. Then your second question of Purusha and Prakriti is it is it is not a part of this actually. Purusha is completely different. It comes under another Siddhanta where it is different from Prakriti. So Purusha is how it came into existence. So that will go into a concept of Prakriti, Mahat, and all of that. So maybe if you can just send us a mail, I will get back to you on that. Currently, and your first question was difference between Jataragni and
Sorry, I muted myself so that I should not disturb you.
yeah, tell me,
Yeah,
sir.
the difference was I just asked what is the difference between Tikshana and Jatra Agni. So generally, what I heard is like Jatra Agni is the digestive fire. So just wanted to know what is the difference between Tikshana and Jatra Agni. Are they
No,
same
so
or different?
no, they're totally different. So Tikshnam is a quality. So Tikshnam can be a quality of anything. We can say a medicine is Tikshnam, or when we say Pittam, Pittam has a property of Tikshnam, that is something that is sharp and pungent. Jataragni, as they call, is basically understood as the digestive fire that we have in our body. And Agni can be of many types that we have discussed now. So they are two different terms. Then again, Jataragni varies, and based on different, when you have some abnormal state, your Agni may vary. And by Prakriti, you have different kinds of digestive powers, which we have discussed as Vishamam, Tikshnam, Mandam, and this thing. So generally, when you are slightly Pitta predominant, then you may have a Tikshnagni, or your digestive fire will be sharp, in the sense your digestion is quicker than what usually it takes. So you might find people frequently feeling hungry, or when on an empty stomach they constantly have some burning or irritation. It's clearly because of a Tikshnagni. That is what it means. So they're not the same. Jatragni and Tikshnam are not the same.
Hari Om Namaste. Mama Nama Lakshmi.
Tell me, ma'am.
Very glad to have this session and looking forward to it, and blessed to be part of this Vyoma. Number one question was like, I have already written in the questionnaire, Ashtanga Hridayam, there are many orders. So kindly suggest the order from your point of view, which is we can straight away go and purchase it. Secondly, the most important thing is to advise us to how to get back to the questions in case arises in our mind. Only that is through email option, right? That is one thing.
Yes.
We can approach. And
you can always approach.
Prashant ji, I don't know, am I correcting, the name is correct, mentioned about the extension of the session, which I would really would like to request you.
Okay.
Pretty much language wise, it is terrifically faster than it is because the subject itself is new to most of us, I believe, and because you're going a little bit faster, kind request to go a little bit slower.
Sure.
And the subject
So,
is very interesting, very interesting. Thank you so much for this opportunity.
definitely. Thank you for your feedback. I think because this is the first session, I think the pace went. I'll definitely slow down my pace from next class. And like I have mentioned, in case we slow down and the PPT spills over, we are unable to finish it, we can always extend it to the next class, or the same day we can extend the time if people are willing to extend and sit for a longer while. Ideally, it's mentioned as 1 hour because then, it'll naturally tend to extend for another half an hour more. But I think from the next session onwards, definitely we can slow down the pace. And the main aim, I would prefer to finish or cover that PPT in that day's session, because it would be more relevant to you, because we are doing it every Sunday only. So if we finish half a chapter in one Sunday and continue it on the next Sunday, recollecting or understanding of that would again be slightly difficult for some people. But we can slow down and finish the PPT in the same day, even if it extends for half an hour or slightly more. Should not be a problem. Anyone else?
Hello.
Hello?
Yeah, ma'am. This is Dharmesh here.
Yeah, tell me, sir.
Yeah, ma'am. Like I had read through some Ayurvedic texts, and I found that there are a lot of references to treating with non-vegetarian things in Ayurveda also actually. So does Ayurveda support this thing like non-vegetarian chikitsa and all?
So again, this is not relevant to today's discussion, but when we move to Aharam and chapters, Ayurveda has mentioned about Ayurveda is not a vegetarian science, or it is not something like that. There are references of meat or animals, or what are their properties, what happens if you consume different kinds of meat. Everything has been elaborated in detail. So once we move into the Aharam part, you would understand better.
Right. Thanks.
Yeah. Anyone else?
And is there any place where they practice this kuti pravesh chikitsa is still anywhere in India?
Not that I'm really aware of, but I can always refer and get back. Not sure as of now.
Bhagini, I have a doubt. This is Ravi
Yeah, tell me,
Kirania.
sir. Yeah.
When we look into the Ashtanga Hridaya, there is there are 3 categories: Sutrasthanam, Uttarasthanam, Chikitsa, Kalpasthanam. So which one would you recommend?
So what we are going through now is exclusively only from Sutrasthanam.
Okay.
Which
Thank
is
you very
mainly,
much.
yeah.
Yeah, sorry, you were going ahead, which is mainly.
Yeah, so mainly has the topics that we are going to cover now, like daily regimens, or for general well-being. Most of it is covered in Sutrasthanam only. When you go to Nidanam, Chikitsa and all, it is more of a physician related kind of text. So you can refer to the entire Sutrasthanam.
Thank you very much.
Yeah. And for all those who asked for any books related to Ayurveda that you can refer that this course, one, you can do Ashtanga Hridayam by with an English translation and commentary that we mostly refer by T. Sri Kumar. And the others we can always by next class I will mention it in a slide and mention, probably you can make a note of it. And the Tamil version I will definitely get back to you by next week. Or if you just drop in a mail, sir, regarding this question of which Tamil book we can refer, we'll get back to you sooner than this week.
Hello, ma'am.
Yeah, namaste. Tell me, ma'am.
Namaste. I just want to ask that if there's any treatment for high BP, like it is 150 or 160 by 100, can it be treated?
So then again, this was the prerequisite of the class, that no personal doubts or medically related doubts will be shared here. Then again, your case will be very personal, and it has to be dealt with a one-on-one physician, why the BP is high, etc. So you can definitely consult an Ayurvedic physician or get in touch for a consultation later, but it is not a part of the course because it's a medically related question.
Yeah, but is it possible or no? Just yes or no, that much.
It again, that's what it depends on, why there is the BP, what is the cause of it, how long it is. There are a lot of factors that determine a curability of a condition, or if there are any ailments that are correlated with it, associated with it, will all have an impact. So there is a no yes or no direct answer. Why it 150 by 100 has to be analyzed first by the physician, and then I think you'll be able to get your answer better.
Okay, thank you.
Yeah.
Namaste, Agni.
Namaste, sir.
Namaste. So I saw a lot of information I got a lot of information. Thank you very much for that. So in childhood, what are susceptible? That they are susceptible to kapha and all that. So what are there any guidelines to follow for when we are raising kids so that we don't give wrong food to the kids?
Yeah,
or is there any? Yes, ma'am.
So the further guidelines or how we can implement these ideologies to prevent anything in our day-to-day life will be discussed in the further chapters. So when we go through dinacharya or daily regimens or seasonal regimens, according to which season, what change we have to make in our aharam. So when all this is discussed, automatically that whole idea of implementing it as a guideline will be got to you. This is only the basics. The further sessions will definitely help you. Yeah, thank you. Anyone else?
Is it Jataragni or Jataragni?
Is Jataragni.
Ja, not Ja.
Yeah. Ja, the first one. Jataragni. Jataragni.
Kirga, Ja, not Jatan.
Small one. Hrasvam and then Tha is Dirga.
Jataragni, not Jataragni.
Yeah.
What you say? Okay, thank you.
So doctors advise not to consume yogurt dadi in the night. Can you advise the reason? So definitely when we deal with aharam and dravyam, properties of dravyas, we will cover this point. I think I missed that question in the question box. Anyone else?
Hello.
Hello. Yeah, tell me, ma'am.
Hi. I have one question. When you were explaining about the doshas depending on the time of the day, like early morning, midday, evening. So our basic general concept of defining morning, day, and evening is based on the sunrise and sunset. Like early morning, we have the sunrise and sunset. So now my question, I mean, you can even answer today or during the dinacharya. So sometimes some of us live in places which are closer to the northern pole or in the northern, like far northern hemisphere, where the day and night is not clearly differentiated how it is differentiated, for example, in Bangalore or in India. For example, we have long summers where the sun rises early morning 2 o'clock and sets in the midnight 12. And in the winters, the sun rises at like say morning 9 or 10 and sets by afternoon 2. So how do we calculate this concept of morning, evening, day and night in these kind of conditions? So, when the sun rise and set is not constant.
Yeah.
Or how do you go about your dinacharyas like when it is like this?
Okay, so I think in those extreme kind of conditions, we will have to see how it can be looked into. The acharyas, when they elaborated this, kept the basic weather situation in mind. And also when we cover Ritucharya, there are, I understand, though we acharyas in our text give 6 ritus or 6 seasons, there are some places or parts of the world where there is almost only 6 months of rain or 6 months of winter and 6 months of summer. So in that kind of condition, it is a little difficult to elaborate how this can be implemented, but you can just give it a rough timing. It is not exactly sunrise and sunset of day and night, roughly depending on that time. So Vayu, Pitam, Kapham does not depend on the sunrise and sunset. Roughly, I have given the timings. Say, in your mid mornings, midday, so and so dosha, there will be a slight increase of it. So it has nothing to per se do with anything. But further on, if you say, for example, constantly stay late nights. So when you stay up late night, 1, 2, 3 constantly, so that night is almost predominant or common for all. So nighttime is night for most of them. Just the timings may be slightly extended or varied. So the doshas will also be in the same this thing. So continuously keeping late nights, for example, which is why I highlighted that point, will because the vayu is always predominant in midnight times. So continuously staying awake, doing late nights or sleeping late in the night, you are slightly more prone to get a vayu kind of a disease. That is what was mentioned, but probably your doubt can be clarified better when we cover Ritucharya, or I will also get back on how we can implement our 6 seasons or the regimens that we can do in countries or places that have extreme weather conditions.
Thank you. And like the last question, Ashtanga Hridaya, I was also looking if it is possible for you to suggest a book where it is in Kannada.
Okay, I'll do that. So just give me a week's time. I will get back to you on translations or commentaries on in all languages. I'll just check out which is the most appropriate one. Yeah.
Thank you.
Welcome.
Ma'am, shall we continue with the next class? The questions
Yeah. So anything else, kindly drop it in the mailbox. If we have missed any ones, kindly make a note of it and we can always cover it in the end doubt session. So anything else, kindly drop it in our mailbox or the mail ID that is given at the end of the PPT, and it will be answered. So someone has asked who decides Prakriti. So Prakriti, that's what I mentioned. It's decided by nature. It is something that is not under our control. So just like how people have concept of genetics and inheritance, chromosomal kind of thing, Prakriti is decided by your sperm and ovary that fertilizes. So what dosha or this thing happens in that is what you will have. So I think if it's okay, we can finish the session. And thank you all for your feedback. I think we can go slower in the next session. And if it's okay, we can extend it by a couple of minutes. And kindly, if we have missed any question, please drop it in our mailbox.